A star rating tells you almost nothing. The reviews worth trusting are the specific ones about how a surgeon listens, tells the truth, and runs the consultation. And the only review that fully counts is the one from you sitting across from them yourself. The thing most people use to pick a surgeon online is also the thing that tells you the least about how they actually operate. So everyone assumes a higher star average means better surgeon. And a surgeon with 40 perfect reviews might have 40 people who never had a procedure at all. A star rating is a popularity contest, not necessarily a safety check. And after enough years inside the world, I can read a review in 5 minutes and see things the average person scrolls right past. Because the 4.9 with gold stars is almost never the most useful thing on that page. What predicts your actual experience is buried somewhere else entirely. So in this video, I want to show you what a surgeon's review page actually tells you, what are the green and red flags most people miss, and the one thing you'll never find in any review that matters more than all of them combined. So the first point is that star ratings tell you almost nothing by themselves. The old belief was simple: higher star average equals better surgeon. So you sort by rating and you start at the top. And it's spread because it's easy, right? One number, one glance, decision made. And every site in the world trains you to shop this way, from shoes and dinner to hotels. And a surgeon with 40 reviews and perfect score might have 40 friends and family members typing. A surgeon with hundreds of reviews, stretching back years, sitting at a slightly lower number average, has a real track record that you can actually weigh. So a perfect score on a thin page isn't a good sign, it's a warning. So if the number isn't the answer, then what are you supposed to look for instead? 3 things, and in this order: volume, so how many reviews there are; recency, meaning whether people are still writing them this year; and specificity, whether the reviews say anything real or just sound like greeting cards. So recommendation from a friend tells you almost nothing if they just say, yeah, they're great. You nod and you forget it, right? But if they say, I told him I wanted to go big and he talked me into something smaller that looked more like me, now you're actually learning something. Same words, but a totally different weight. And the difference is in the details. So once you stop trusting just the number alone, the whole page reorganizes itself. You start reading like a detective instead of a shopper. And this brings us to the obvious question: if specifics are what matter, specifics about what exactly? So read for behavior, not just happy endings. Most people skim for one thing: I love my results. And they count up happy results and call it research. And that spreads because results are why you're here, right? You want the after photo, the happy results, proof it worked. So those are the lines that are going to grab your eyes and your attention. A glowing result review tells you the outcome was good for that one person with that one body and that one set of goals. But it tells you almost nothing about whether the surgeon actually listened, leveled with them, explained the risk before they ever got near an operating room. Happy results tell you how it ended. The consult tells you how it's going to go for you. The reviews you slow down for are a different kind. So look for reviews that describe behavior. Did the surgeon actually listen to what the person wanted? Did they explain options in plain language? Did they tell the person something they didn't maybe want to hear, like wait, lose weight first, or do less than they came in asking for? The last one is gold. Any surgeon can say yes to a paying patient, but the ones worth trusting are the ones who'll turn down money and tell you to hold off when holding off is the right call. Because that's the same person who's going to make the honest choice on the table when you're asleep and you can't advocate for yourself. So when you read behavior instead of just outcomes, a 4-star review full of specifics can outweigh a wall of 5-star reviews that all sound the same. So now let me show you how to do all this fast without reading 200 reviews at midnight. Hey, real quick, if this is already changing how you look at the page full of tabs, do me a favor and hit subscribe. This channel is built to help you make smart, calm decisions about your body instead of panicked ones, and I'd rather you stick around for the rest. So the third point: how to read a review page in 5 minutes. You don't have all night, and you shouldn't need it. A few minutes of reading the right way beats an hour of reading the wrong way. So red flags: reviews that are all generic and interchangeable. The kind you could copy and paste between 10 different practices and never notice. Another red flag: practice that only responds to praise and goes silent or defensive on any criticism. Green flags are reviews that name what the surgeon actually did, how he handled the room, and the practice answers hard feedback like a grown-up instead of arguing about it. So do these reviews mention the surgeon by what he did, or could they be about anyone with a scalpel? Are people still writing them recently, or did the page go cold 2 years ago? When someone left a less than perfect review, how did the practice respond with care, or was it with excuses? So run these 3 phases and the pages sort of sort themselves out. Fluff falls away, substance is going to rise to the top. And when you walk away with a real read instead of a vibe. But even a perfect read of a perfect page leaves one thing out and it's the most important thing of all. No review is going to beat an in-person consult. Every review on that screen was written by someone whose bodies, goals, and risk aren't yours. And the strongest read you're ever going to get isn't on a screen at all. It's an hour you spend sitting across from the surgeon, watching whether he tells the truth to your face. So this is where I think within the Portland area, it's worth knowing. I'm Dr. Eric Aghion, board certified plastic surgeon with the American Board of Plastic Surgery. Got over 14 years of practice. Thousands of procedures are under my belt, and my whole approach is built around the things that good reviews point to. I try to listen to what you actually want instead of imposing what I think you need. I'll tell you to wait, lose weight first, or maybe have less of a procedure, maybe even none at all, even if that means it's going to end up costing me in the practice money. I try to treat my patients the same way and with honesty that I'd give my own family and friends. I try to use 3D imaging so I can help give you realistic options as to what your own body is going to look like before you decide on anything. And hopefully that's going to give you an honest sense of what the consult's going to feel like. So stop trying to settle this entirely from the couch. The internet can narrow your list down, but it can't finish the job. So start treating the consult as really the real interview. It's the one where you're going to ask hard questions and watch. Do you feel like I give you straight answers, or does it feel like a sales pitch? And that brings us back to where we started. And the one thing I want you to carry out of here: read reviews by all means, just read them the right way. Skip stars, hunt for specifics about how someone listened, whether they told the truth. Notice how the practice handles criticism. And remember, the real test isn't on a screen. It's whether the surgeon's going to look you in the eye, tell you the honest answer, even when the honest answer isn't maybe the one that you wanted. So low pressure suggestion: check out our reviews for yourself, take them apart the way I just showed you, and then come judge the only review that's fully going to count. Book a consultation with Apre Plastic Surgery here in Portland, Oregon. Sit across from me and get an honest assessment. Even if that honest assessment turns out to maybe be wait or do less or not yet. That's the kind of straight talk you came looking for, and it's the only way that I really know how to do things.